I think the two big stories out of ESMO this year were probably MONALEESA-2 and DESTINY-Breast03. DESTINY-Breast03 was presented by Dr. Cortez. It was our so-called second-line trial, TDM1 versus Trastuzumab deruxtecan. As you know, TDM1 is currently approved in the second line, and Trastuzumab deruxtecan is currently approved in the third line. So really a trial to bring this up in the second line head-to-head with TDM1. And we saw a hazard ratio of 0.28 in favor of Trastuzumab deruxtecan. In the central review, the progression-free survival was 6.8 months versus not reached. But at the local level of investigator review, it was 7.2 months versus 25.1 months in progression-free survival. So an improvement of 18 months or a year and a half. So this really was quite encouraging. I think the other thing I was very encouraged to see was our previous data was from DESTINY-Breast01, which was, earlier on presented in 2019, et cetera. And we saw some fatal cases of pneumonitis there. Here, since learning about the pneumonitis, having very direct instructions about what we should be doing with grade 1 pneumonitis, grade 2 pneumonitis, et cetera, we were able to get the pneumonitis ILD rates down by quite a bit. ILD was 10% across the entire trial, but notably we saw no grade 4, no grade 5, and only 0.8% grade 3 ILD. So I think this really gave us the confidence that we can safely give this drug in earlier lines. So I anticipate we'll be seeing more of this. On the other hand, MONALEESA-2 was pretty dramatic, not because it's the first time we've seen data from this. We've already seen progression-free survival improvement from 16 to 25 months. Again, letrozole with or without ribociclib in the first line setting. Dr. Hortabaji presented this at ESMO. What we saw here was overall survival data in the first line setting. And remember, we have a lot of overall survival data in the second line setting in fulvestrant combinations with CDK4/6, but we have not seen this in first line. And we'd say improvement of OS by 12 and a half months. So to me, this really was just practice affirming that we should be giving patients CDK4/6 inhibitors in the first line setting. We really should be offering this to all of our patients unless the patient has some other comorbidity that's competing with survival for their metastatic breast cancer. I was also encouraged to see the split year over year. So they looked at the OS benefit at 4 years, 5 years, 6 years of follow-up. And at 4 years, it was 5.7% improvement for those patients that got ribociclib. But when we got up to 6 years, the benefit was 12.2%. So really showing that that benefit is increasing with further follow-up, which I thought was very encouraging.